I'd just like to say a few words about the Medicare Local, the Northern Medicare Local, and while I'm relatively new, I've sat on the other side of the Medicare Local table as a provider of services, so similar to where you're coming from as CEO of a number of community health services around Melbourne, etc. So I'm pretty familiar with the processes that occur. In fact, sat on the other side of the table when the PIR tender and cooperative arrangements were being put in place for this particular tender. So I'm very interested to see the outcome of all of that and to see how it goes. In terms of the Medicare Local region, there was some 700,000 residents covered by this Medicare Local. We have an estimated 1,770 eligible people who could benefit from the PIR program. It's expected that by 2016 we'll have 700 people engaged in a program with approximately 30 staff. PIR is delivered by Mind Australia, Nimi National and the Victorian Aboriginal Health Services. Those partner organisations are well represented here today along with 16 consortium members. We have goals and targets and we're committed to working with all of you to achieve those and to start better linking mental health care services for the people who need it most. Much of the groundwork has been done, the scene has been set, and we know the role of the program. We're here today, however, to look at ways to improve the program, identify opportunities, and to celebrate success and collaborate as partners. And I was interested in the comments of Auntie Di in the context of the expectation of clients and consumers that we'll actually provide a joined-up service. If there's a role for the Medicare Local in any of this, apart from purchasing the service, it's actually to work with making sure that the system gets joined up in the interest of the clients. And I think one of the potential criticisms we've got to be very aware of is that while mental health may exist as a very good silo of service, it is one silo. And the need to be connected across the primary healthcare sector is terribly important. And so that opportunity is there. What does that mean? We need to tease that out, and certainly it'll be one of the things that the Medicare Local turns its mind to, apart from funding the services, is how do these services get connected? What's the benefit for the client? How are mental health services being connected to the general primary healthcare network and the broader systems around it? So just in terms of the Medicare Local, we are a very young organisation. Medicare Locals are very new. We have passionate staff, exciting ideas and responsibility to our local community we take very seriously. But they are very new organisations. Medicare Locals are feeling their way, trying to figure out how it is they add value to the services, the service system that we're here to work with. You know about our work with partners in recovery, but what you may not know is what we're achieving in other areas. We're working hard to ensure better access to services by linking GPs, nurses, other health professionals, hospitals, aged care and ATSI health providers. We're improving access to GP services after hours by planning and supporting regular GP services through incentive funds totalling more than $1.5 million. We have supported medical clinics in the north to open late. So one of the nice things for your client group is that there are now a range of after-hours GP services available around the northern suburbs. So that's a good thing. It's not perfect by a long way, but it's an improvement on what has been available. And so we'd be keen to get feedback from you about how effective that investment has been, because while the GPs will tell us it's excellent, you know, it will be good to hear from you about how your clients are going getting access to those things. In our fastest growing regions across Hume and Whittlesea, 22 extra clinics are now open late. So that's a great achievement. And I know Stephen on the board of the Medicare Local, who's going to be speaking shortly, had a big role in making sure that those after-hours services got targeted and are going in the right places. So again, we'd be interested to hear your feedback about that at some point. Additionally, if the local medical centre is closed, a request can now be made for a home visiting doctor. It's free, open to all residents regardless of location. 26,000 urgent home visits were made during the previous 6 months in our northern Melbourne catchment. Following the most recent devastating bushfires in Melbourne's outer north, excuse me, officers from Hume City Council toured affected regions, providing information about free qualified counselling available to residents needing mental health and emotional support through the ATAPS program. Similarly, colleagues from Nillumbik Shire Council distributed brochures to community houses, local shops, notice boards, etc. following the anniversary of Black Saturday. This free counselling services is offered by Northern Medicare Local. Since June last year, we've enabled more than 800 people across Nillumbik, Banyule, Darebin, Whittlesea and Hume communities to receive 5,000 psychological services for anxiety, depression, suicide prevention, postnatal depression and child mental health. This is just a taste of some of the work that this Medicare Local is doing and other Medicare Locals across Australia. There are opportunities aplenty to make a great difference to the lives of many people in our community. But I'll just finish by saying that, and I think Auntie Di was exactly right, you know, the ball is in our court as people who have a significant investment of taxpayers' funds in our services. It is not good enough for us not to be advocates of connecting the system in the interests of our clients, not because it suits us to do that, but because your clients need a variety of services well beyond mental health. And so we need to work very constructively and very cohesively, very actively to make sure that suite of services is provided. I've worked in this sector. I know how it works in terms of the silos and the competitive nature that can sometimes occur. And so I suppose from the Medicare Locals point of view, sitting on this side of the table now, my desire is to see that we actually put the competitive stuff aside and start to think about cooperation and integration, service coordination, best practice teams, etc., etc.